Hello friends, very important topic to start with, the complications of unsafe ear or the chronic suppurative otitis media unsafe variety. So the most common these complication can be divided into intracranial and the extracranial. The most common intracranial complication is the meningitis, while the most common extracranial complication is mastoiditis. Now if the examiner asks what is the most common overall complication, it will be mastoiditis. So don't confuse here. The most common intracranial complication of CSOM is meningitis, and the most common extracranial and the overall complication is mastoiditis. Now the second most common intracranial complication will be brain abscess, in which mostly temporal lobe is seen to be involved. The other intracranial complications are the extradural abscess, subdural abscess, optic hydrocephalus, and the least common among all the intracranial complications is the lateral sinus thrombophlebitis. It is one of the serious intracranial complication, in which we see two signs, Grissinger's sign and the Croway-Breck sign. In Grissinger's sign, what is this sign? This is the palpable mastoid veins over the scalp, is known as Grissinger's sign, and the Croway-Breck sign is the big retinal veins. We can see a big retinal veins means can be seen over the cornea, means over from the eyes on ophthalmoscopy. When we do the retina examination, we can see the big retinal veins, which is known as Croway-Breck sign, like these two lines, big lines. So summarizing, the intracranial complication are the extradural abscess, subdural abscess, meningitis, brain abscess, optic hydrocephalus, and the lateral sinus thrombophlebitis, in which we see Grissinger's signs and the Croway-Breck sign. The most common intracranial complication is the meningitis, and the most common extradural complication is the mastoiditis, and the most common overall complication of unsafe or the CSOM chronic otitis media is the mastoiditis. Mastoiditis is the most common extracranial as well as overall, while meningitis is the most common intracranial. This means this question is very basic, and we cannot afford to make this wrong in our exam. Now one more sign we see, which is known as Tober-Ayer sign in lateral sinus thrombophlebitis. What is this sign? Mainly this sign can be elicited by increasing the pressure on the jugular veins. What we see generally, there is increase in intracranial tension or the pressure on pressing the jugular vein, but if there is lateral sinus thrombophlebitis, there will be no change in ICT on increasing the pressure. Also, we see picket fence fever or the hectic fever in the lateral sinus thrombophlebitis. Another sign seen on CT scan in case of lateral sinus thrombophlebitis is delta sign. Now the extracranial complication, as I have already told, the most common extracranial complication in the overall is mastoiditis. Most common symptom of mastoiditis is ear discharge, while the most common sign which you can elicit is tenderness over the mastoid. The earliest sign or the hallmark sign is the sagging of canal. Like this, you can see the canal wall sags down in the external auditory canal. And the other some MCQs, just some random MCQs is if we see abscess along some muscle, they have some specific name, like abscess along sternocleidomastoid muscle is known as Bezold abscess. Abscess along the digastric muscle is known as Sitelli abscess, and the abscess within the external auditory canal is known as Lux abscess. Now, if the other extracranial complications are the petrositis and the lateral canal and the labyrinthitis and the facial nerve palsy. Facial nerve palsy, mainly the tympanic part is affected, as the tympanic part of the facial nerve, if we use common sense, the tympanic part of the facial nerve will be involved in case of any middle ear disease. And the labyrinthitis, the lateral canal wall of the middle labyrinth is involved, lateral canal, and the lateral canal is involved. Okay, and the petrous apex is involved in petrositis, and we can see a syndrome known as Gradinego syndrome, in which there is severe otorrhea, severe periorbital pain, and diplopia. So Gradinego syndrome is a triad of severe otorrhea, periorbital pain, and the diplopia. Diplopia due to involvement of sixth nerve, severe periorbital pain due to involvement of fifth nerve, and severe otorrhea. So two important take-home messages: one, this Gradinego syndrome, a triad of severe otorrhea, severe periorbital pain, diplopia. So if you see a question having the patient having severe otorrhea, periorbital pain, and diplopia, you should think of petrositis and Gradinego syndrome. And another take-home message is the lateral sinus thrombophlebitis, in which we see Grisinger's sign, that is the palpable mastoid veins, Crowell-Beck sign, that is the big retinal vein on ophthalmoscopy, Tober-Ayer sign, that is no change in ICT on increasing the pressure, and the Pickett-Hens fever or the hectic fever, and the CT sign, that is the delta sign, which the delta means a thrombus forms a delta shaped structure in the CT scan. We can see on the lateral sinus thrombosis. So do remember these points. It's very important and the frequently asked topic. Thank you.